Hi, this is Elaine.
And this is Dr. Jonas.
In this episode of Apostolified Conversations, we will be talking about one of the most important foundations in doing dental procedures, and that is
Trust.
yes. So stay tuned, and we hope you enjoy this conversation. Hello, everyone. Welcome to another episode of Apostolified Conversations. So we're now on episode 5.
Bilis.
Ang bilis, grabe. Again, every time we are filming this, we would want to say thank you for your support.
Whoever you are, thank you.
For the viewers sa YouTube, for our listeners, of course, on Spotify. Thank you. And I hope that you are learning a lot and enjoying our conversation. So, Doc Jonas,
Yes. Miss
for
Elaine.
this episode,
Yeah.
we will be talking about one of the most important foundations in doing dental procedures. And that is trust.
Trust.
That's one of the most important foundations in doing any procedure, even medical.
Yeah, of course.
So, dental and medical.
100%. Yeah.
So, i-define muna natin what is trust.
Game.
Okay. If pupunta po tayo sa Google, what is trust? Definition of trust.
That's all.
Definition of trust sa Google. It says, noun siya. Pwede rin siyang verb. Firm belief in the reliability or strength of someone. Again, it is a firm belief in the reliability or strength of someone or something. But here in this case, of course, someone, and that is Dr. Jonas and our dentists here at Apostol Dental. Okay. So,
Yep.
what is trust
Yun na, sabi niya.
in dentistry?
It's actually,
Specifically
yeah,
in dentistry, Doc
it-
Jonas.
It's almost, it's exactly like that. You have to believe in your dentist. You have to believe in the one who will be doing your case because you don't have a choice. Okay? Wala kang choice. You give that power to the one or to the clinician who will be doing your case. And at the end of the day, it will be his result. So wala kang ambag doon, but you have to trust kasi
Walang choice, Doc Jonas, when the patient is already in the clinic on the chair.
Yeah,
Of course, the choice is always
exactly.
theirs. Pipili silang dami-daming practitioners out there. They can choose whomever they want as their dentist. But once they are there, seated on the dental chair, discussing, and then isa-start na yung procedure, actually, they still have a choice. Initial assessment, the dentist will discuss the procedures, the prices, everything, the timeline.
Exactly.
If the patient doesn't want it, they have the choice to, Doc, let's do it next time, or let me think about it.
Exactly.
Hindi naman natin sila i-force na to let them stay. So they have a choice to come back, to leave the clinic and then come back. If ma-finalize nila yung decision that they will continue doing the treatments with us,
Yeah.
then they will not have a choice.
Yes. Ang ganda ng explanation because that is our system here in the clinic. That's the reason why we have our assessment, clinical, radiographic, and then we discuss the patient's problem, and then we formulate a treatment plan for the patient, and then we discuss also the prices para at least hindi sila lost. Aware sila of everything, and even with the procedure na gagawin We are actually
Explaining thoroughly.
explaining
Yeah.
everything thoroughly, the expectations. So, after nun, yeah, tama ka.
Yes, and doon actually nagsastart yung trust.
Doon.
That when the patient accepts what the dentist will say to him or her, then that's where the trust starts to build. Or yun yung nagiging foundation na.
Yeah,
Kasi wala na silang choice when they, okay, let's do it.
exactly.
They don't know, they don't have any knowledge with the procedure. Di nila alam yan. Even if they research, hindi pa rin nila alam what will be done specifically on their case. Kasi it's always case-to-case basis.
Yeah, it's always case to case, and then you can actually learn from others, like family, friends na nagpagawa or nagpa-treatment. But at the end of the day, the reaction will always be different because we are all unique. Iba-iba yung chemical composition ng katawan, psychological complexity, iba din. So we have to take note of that na hindi siya dapat na kung ano yung reaction, ano yung result ni patient A, yun din yung magiging result or reaction ni patient B. Kasi it's...
And that's why, with what you're saying, that's why trust is important. Because a patient doesn't know that.
Exactly.
Only the dentist. Okay.
Yes.
So, Doc Jonas, can you tell me how does trust impact the treatment
Okay.
positively
Okay.
or negatively? So, how does it impact?
Sige, ganito. I will, syempre as a cosmetic practitioner of aesthetic dentistry, we handle a lot of patients when it comes to like enhancing the smile, the teeth. So we're talking about veneers, bridge, or crowns. So these things are very complex because it's not like I place it in, you will be able to see the result and that's it forever. No, I mean, when it comes to these type of treatment, it requires time for you to adapt. It requires minimum of 6 weeks yon and maximum of like 6 months, for some a year.
So,
So,
Doc,
matagal.
yun nga. So, how does it impact?
So,
Trust
yung
on
trust
the-
na yon kasi minsan, eto, pag nakita nila, they would react differently. Like, even if you explained it to them, doon na pumapasok yung doubt sa mind nila na this is not what I've asked for. This is not the result that I am expecting. So, they actually sometimes nagiging hysterical about the sa mga result kasi hindi pa nila nakuha agad-agad. So you need to trust because hindi pa nag-a-adapt, especially when it comes to dental procedures like yung sinabi ko, cosmetic procedures or even surgery kasi it requires time to heal. It requires time for the gums to settle down and to adapt. So, it will take time talaga. So, you have to trust the process and the one who's handling the case. And in this scenario, it's your dentist. So, dapat yung trust should be 100%. You can only trust the process. Ganun palagi. In everything, you have to trust the process. If you cannot control it, trust the process. If you can do something about it, then do something about it. If you feel that there's a mistake, then you have to do something about it. Pero pag wala talaga, then just trust.
Yes. So, to add to what you said, how trust impacts the treatment or the outcome, sometimes if the patient just really puts their trust on you or to our dentist, it goes smoothly. Everyone is happy, how it's done, maayos lang, kalmado, very smooth, stress-free. But if the patient, you see that the patient has doubts or reacts differently, then nagkakaroon ng tension sa heart ng dentist. I'm saying this because, again, I'm here every day and I see not only Doc Jonas, I see the other dentists working. Nagkakaroon ng hurts sa kanila because they're into what they do. Committed sila to our patients. And when they see the tinge of doubt in you, na stress sila. But then, of course, mag-iiba yung how they handle the situation. But then again, of course, they are specialists or they know what they do. Hindi sila magkakamali because they know what they're doing. But nagkakaroon na sila ng sadness or negative feeling because of that distrust. That's why trusting your dentist is very important. Para happy lahat. Chill si dentist, chill si patient. Of course, hindi naman natin masasabi it will always be smooth. But then you can control na magiging masaya lang. Di masaya rin yung experience mo with the dentist. Masaya yung total experience mo for the procedure. Okay, so next is with trusting kasi Doc Jonas, the patient also has to be open with you.
Yeah.
Diba? It's part of trusting the dentist because, example, you are feeling something or meron kang questions that you want to be answered but you are scared na baka hindi ako sagutin ni Doc or baka magalit siya sa akin if I ask this. That means you don't trust. Kasi you don't open up to your dentist. So, with the patient opening up to you, will it be better?
Yeah.
Will it help you to deal with the procedure better?
Precisely. I mean, it's always good that I would know something about you or about the patient kasi ang dami kasing at stake nun eh. I mean, hindi siya basta-basta like kunwari what I do is a bit of very very complex. Hindi siya yung parang tipong after I'm done with the procedure, walang nagbago. Mayroon talaga. Especially with my specialty, I reduce a little bit of teeth. So this part of your body won't be able to regenerate back. Hindi naman babalik yun. So that's why you have to tell me everything so that I can know what's in your head. Kasi wala akong
Power.
Hindi ko malalaman.
Or magic.
Hindi ko malalaman kung hindi mo sasabihin. That's
Okay.
why.
Yeah. Doc Jonas, na-discuss na natin to during episode 2. But for those who weren't able to tune into that, di nila narinig yung part na yun, how do you establish trust with your patient?
Well, number one, you have to, ang ginagawa ko is,
Ikaw specifically, Doc
I
Jonas.
talk to the patient, I explained everything, establishing rapport. It's more of like talking to the patient, like that they will see, that they will know your intention, that they will know who I am, and my commitment to the work. Kasi ganun lang siya. Ganun lang siya kasimple. If you don't trust your dentist, or if you don't trust your doctor, don't go in a procedure na very sensitive tapos papagawa mo sa tao na hindi mo talaga pinagkakatiwalaan. So don't do that. You have to research, you have to dig deeper, and you have to build that trust. Kasi sometimes for some people it's easy to trust others, but for some, because syempre life, it will teach you a lot of things na not to trust to someone. Kaya affected din yung profession, but it's fine. Ganun naman talaga at the end of the day. Pero I would advise for the patient that you have to find a reputable one, and then you start trusting them. Ganun.
Another thing that what we do here is we always research, we always study, and especially si Doc Jonas. Kasi it is hard for a patient to ask a professional or kunyari, ask niya si Doc Jonas, hindi siya makasagot. Paano magkakaroon ng trust? Hindi nga masagot yung question. So, here, whenever I check Doc Jonas and the patient doing consultation, din maraming questions si patient. Si Doc Jonas, hindi siya isang tanong, isang sagot. Isang tanong, ang daming sagot. Ang haba ng sagot. And that's where the patient also gets to know Doc Jonas. Marami siyang alam. Yes, of course, it's still theoretically, paano niya mapuprove yung self niya by simply answering questions. Theoretically pa lang. But when he goes into the procedure, does it yung result, doon mo na malalaman, yes, he is a skillful one. And that's why efforts that we do, marketing efforts, we post before and after, we explain, nagkakaroon kami ng Ask Dr. J sa Instagram, pag may mga questions, para you know that, hey, this dentist right here knows what he's doing. And not just theoretically, but also with his outcome. And marami kaming ginagawang documents that will support also the process, hindi lang the outcome, but the process itself. What do I mean? The materials that we use, the technique, the machines. So when another professional, let's say another dentist would ask us, how did we get to that outcome? Baka may mali kang ginawa. Kasi syempre, the before and after, that's it. But the steps, the specific steps, we also record that. Kaya we always take pictures, yun, na para for you to trust us that we know what we are doing and close to perfect siya. If not perfect, very, very close to perfect. Because dapat ganun yung work. Doc Jonas, do you agree that when there is trust between the doctor and the patient, there is lesser anxiety sa dental chair?
Of course, 100%. I've done thousands of veneers, bridges, crowns in just a year, diba? That's my practice. And I can say that pag 100% yung trust, usually the preparation, less than let's say, for example, for a veneer, ideal veneer preparation, it will take me 15 minutes to complete the preparation. Easy. Ideally. And then also with everything, with the temps and lahat, an hour 15, tapos na. Walang problema. Pabalik ang pasyente. After a week, we do try-in and then cementation. Finish. In like 1 hour, na-cement ko na. Pagbalik ulit, for a recall, follow-up, removal of excess, T-scan and everything, an hour. Plus, may night guard na. Tapos. And then after 6 months, pabalik for cleaning. Tapos.
So when there is full trust, the procedure is faster.
Exactly.
Chill pa yung sa loob ng room mo. Happy pa.
Happy kami lahat.
Happy kayo lahat.
Happy lahat. Happy ang operator. Happy ang dentist. Happy ang assistants. Happy ang lab. Happy ang sa reception. Happy lahat. Happy ang environment. Pero pag heavy ka, like wala kang trust, parang gloomy ng lahat.
Yes.
Tapos dinadala mo pa sa clinic. Grabe naman.
No,
yun?
really, ganito kasi.
Ganun.
We had patients in the past. Full trust siya kay Doc Jonas. But, when she comes back, naka-research daw siya more, then nagkaroon siya ng doubt.
Mm-hmm.
Because iba yung case na na-research niya sa ginawa ni Doc Jonas, na-compare. So, you will feel hindi naman niya sinabing nawalan siya ng trust, no. But you will just feel na naging gloomy yung disposition niya.
Yeah.
Because she compared the research to her own case, which a patient should never do.
Yeah. Yung research na yan, nakakatawa kasi I spent years of studying basically on one subject, aesthetic. Tapos magre-research kayo ng isang araw, 2 araw, 3 araw,
Not days, hours.
hours.
Grabe naman.
Sabihin mo ng 1 week kayo nag-research.
Sige.
Hindi nyo po yun patatapatan
Yes.
yung research ko.
Yes.
Okay? So, I'm doing lots of papers about cosmetic. So, hindi po.
Papers and actual.
And not just papers, not just theoretically. I've done thousands already. So, that's funny sometimes because may biglang shift nga na parang instead of like ang dali na sana, na-mess up pa. Actually, hindi siya mess up eh. Sobrang simple. Even a simple procedure, nagiging complicated.
Correct.
It shouldn't be that way kasi ang dami ko gina-handle na mga super complex, difficult case na I made it look easy. Why? Trust. Trust. Because if I can't do it, I won't do it. Ganun lang kasimple yun. I mean, I'm not in sa experience ko ngayon, hindi ako magre-risk if I don't know things. I will not experiment on patients.
Of course.
Wala na, tapos na tayo doon. Tapos na tayo sa ganong age, sa ganong era ko. Kasi experienced na ako when it comes to dentistry, and I always make sure that what I do is based on world standard. Hindi siya standard lang. Hindi standard lang ng school or dito or whatever. We are looking at standard ng the best of the best. Kasi yun naman talaga yung ina-aspire natin, yung palagi natin ginagawa. That's why we don't stop learning. We don't stop learning.
That is the Apostolified way.
Yeah.
Yes.
Kasi yung standard 5 years ago may not be the standard now.
But
so,
don't get us wrong. Baka sabihin, bawal pala mag-research. Of course not. You can always research. Research ka ngayon, research ka mamaya. We will not stop you. But you still put your 100% trust. You can ask questions. Diba? You can perhaps challenge.
Yeah.
Because you have the right. Easy lang i-research mo sa Google. But then again, you need to trust. Because yung na-research mo can never be exactly the same as your case.
Kasi ang daming ways eh. Like
Meron pa nga fake news nasa online.
yeah.
Kala mo totoo, fake news pala.
Uh,
How would you know? You did not study dentistry. So, trust.
exactly.
Ganun lang.
Ang dami natin.
Oo. So, yun. To end this episode, tatagalan naman tayo. Well, to end this episode, no, another thing that is beneficial when there is trust between a patient and the doctor is the long-term relationship that we build. So, a long-term relationship na happy relationship, pupunta sila sa clinic, ang ganda ng aura nila,
Yeah.
makikipag-chikahan, no stress, cleaning, tapos tatayo, chikahan ulit, then ganun ulit, after 6 months, happy ulit. So, the great long-term relationship is there.
Yep.
Because you just continue to trust your dentist.
Yeah.
Lang.
100%. And ganun dapat.
So, trusting your dentist is very, very important.
It's important.
Because at the end of the day, you do not know the procedures that will be done to you. You may know it, you may research it, but ito mga dentista na to, ito yung mga talagang nag-aral.
Yeah. At saka dagdag ko lang, no? I mean, hindi kasi kami, I cannot speak for other dentists now, but I can always only speak for myself. I'm not a part-time dentist. I'm a full-time dentist. When it comes to dentistry, yung training, yung dedication ko, yung passion ko, it's like I'm in Olympic competition. I don't compete here. I compete in the world. I compete with myself. I always make sure that I practice even after office hours, even without patients. Study. I practice. Ganon. Ganon yung dedication. Parang white belt mentality. Pero black belt attitude.
Okay. So, the very essence of this episode is because the next episodes to come, episode 6 onwards, heavy na tayo on cases. And these patients that we will be showcasing, magandang outcome because of the trust that they gave to Dr. Jonas and to our other dentists. So, there you go, guys. Thank you for tuning in. And if you have other questions, just message us. And we hope that you enjoy this conversation. Thank you, everybody.
Here.